The spread of the coronavirus in the United States is fueling baseless fears and bias in Arizona against Asians. Experts say it's common for some people to be targeted during a public health crisis of this magnitude. Cronkite News reporter Sida talked to experts and some members of the Asian community who say they have felt shunned based on misinformation and why it happens.
Those I talked to say history repeats itself. One expert even says the treatment of some Arizona residents could be called a humanity crisis. Says it started with whispers when she sat down to study with other Arizona State University students.
I could tell that they started to be really uncomfortable. Like they started getting really tense. They started whispering to each other.
Dang is Chinese American. She says people got up and left her alone at the table.
An incident like that hasn't really happened to me before, but I could tell that it was because I was Asian and because of like the news about how a case at ASU got out that had someone that had the coronavirus.
She's not alone in feeling the stigma. Chandler engineer Paul Berdonado says he is concerned about being profiled by airlines.
So instead of flying to LAX, I'm considering just driving to LA instead.
Evan Wynn at ASU says students have been sharing their stories about their encounters with ignorance.
Yeah, based on stereotyping and profiling, and it's also just been a trope specifically with like this paranoia and racism and xenophobia with disease.
Bias against groups that represent those most affected in a public health crisis has happened time and again.
Our country also experienced certain incidents because of certain disease outbreak or certain virus. For instance, 1990, the HIV/AIDS incidences, the gay community were subject to stigmatization in terms of they are all blamed for the virus and the disease.
Lee also says bias occurred in the early 2000s with SARS and again in the 2010s with Ebola. People blame these groups as being the source of disease, and the targets often are people who belong to racial or sexual orientation groups.
They are visible. And people already have stigma against them in any possible way.
That means a public health problem can turn into another kind of loss.
The outbreak of the virus is really a public health crisis, and I really think we as population in this country and in the world community should not make it become a humanity crisis.
She says those who start to turn fellow human beings into faceless others should learn the facts.
To rely on scientific solution for prevention of future and the cure of this current virus outbreak.
Dang says instead of turning away from Asian Americans, turn toward awareness.
I think it really ostracizes an entire community, and I don't think that's right in any way. And again, instead of making assumptions, we should have open conversations about it.
ASU President Michael Crow issued a statement Monday that says the university is committed to inclusivity and encourages students, faculty, and staff to, quote, diminish the impact of misinformation, unquote. In the studio, Sida, Cronkite News.